envisions a world where every child is safe from harm everywhere, all the time. A world where every system working with children makes child protection a priority and holds themselves and each other accountable for children's safety. However, the statistics on child harm are alarming, and the problem is one of enormous scale. 100,000 children go missing every year. Over 1 million children are victims of trafficking. 47% of girls are married before the age of 18, and 1 out of 2 children report sexual abuse of some kind. Despite robust legislation, laws, innovative social policy, and programming for adolescents, the actual implementation at the ground level continues to be a challenge. While there is a well-established raid and rescue system, typically state resources are allocated for rescue work post the occurrence of harm. Systems for prevention of harm remain deeply neglected. For Aangan, the crucial question, therefore, is how can child harm prevention systems be built and strengthened so that the poorest, most marginalized children have a safe childhood, free from the interconnected dangers like child marriage, child trafficking, or hazardous work? Given the fact that each of these issues is interconnected, with little available data on child vulnerability, policymakers typically rely on aggregated national data when it comes to child protection policies and government programming. However, the ground level practitioner, and in Aangan's case, our community women-led networks, have access to little or no data that is useful to plan or track action. Adding to that, so far data collected and used by organizations like us that is viable and formalized is often only used for academic studies and done for research purposes. Now, the time taken to do a full-fledged research often makes the data irrelevant to take any action. Supporting the belief led by many researchers, we too believe that relevant hyperlocal data has the potential to make significant impact on preventing and responding to the increasing rates of child harm. Our own experiences has helped us see that using community knowledge and ground level insights has the power to create a set of new and actionable data points that were previously underutilized. We've learned that giving the community access to local data collection tools, coupled with the right kind of training, can create an impactful and sustainable change. For example, in Littipara block in Pakur in Jharkhand, community women were trained to use a community safety mapping tool where they identified high incidence of children being out of school. Based on the community's understanding of the issue, they highlighted that children being involved in labor was the biggest reason for them having to drop out of school, with young girls being hired as domestic help and boys working on agricultural farms and beedi rolling. They shared their findings with the school principals with 2 key asks: a meeting between the principal and parents to talk about the importance of staying in school, and secondly, carried out an enrollment drive to have children back in school. This resulted in 388 children from Littipara block being enrolled back in school in 2019. Now, when women in Patna mapped their communities and shared the data with police, it resulted in increased patrolling across 8 police thanas, making unsafe spaces safer for over 2,200 children, for them to be able to access public spaces, toilets, etc., especially at night. But even when communities were leading change to keep children safe by collecting and sharing data, we had to fight the persisting challenge of doing this in a timely, efficient, and non-arduous way. The answer to this problem, though simple, was a little scary: technology. We did, however, start by leveraging the use of technology in 2 very simple ways. First, we digitized our child protection training content and our data collection tools, moving away from the pen and paper approach to developing easy-to-use mobile applications that made data collection, data analysis, data sharing possible in a timely, actionable, and feasible way. And secondly, but most importantly, we equipped our women-led community networks with a basic smartphone. Through these 2 simple steps, we have a few learnings that has had an impact on our programmatic outcomes and our ability to scale. First, using digitized curriculum and tools to train our women-led networks and a range of other stakeholders, including government officials, on child protection has allowed for wide-scale usage, especially with populations with low literacy. In addition, it's made child protection content more accessible and available to practitioners working with children. Equipping communities with smartphones has instilled a feeling of confidence and increased agency and community connectedness. During one of the training sessions at Hingalganj in North 24 Parganas in West Bengal, our field coordinator started the training by teaching the volunteers how to type and send messages. These women, who had never used a phone before, were simply elated to use a touchscreen phone and were curious to see what happens when one clicks on something. Most of them said that their husbands had phones, their children know how to use phones, but they had never gotten the opportunity to use a smartphone. It's not that these women were new to data collection, it's just that technology had always eluded them, and hence they were excited to get a chance to use it firsthand. Secondly, sharing real-time data with authorities is key for taking timely action. Drawing from our previous experience, we identified that community members know their communities best. Their local intel on prevalent child risks can be a powerful driving force in activating local stakeholders for taking actions to keep children safe. We've also seen that customized solutions that are co-created are more effective and have a positive longer-term impact. Through technology, women were able to collect and share real-time data that allowed officials to take action in a timely way on child protection issues that were previously unknown. Adoption of data-driven tech solutions using simple mobile applications to collect individual family vulnerability data has made it easier for community women to identify key trends that are prevalent across the district early on. We now use our interactive dashboards to track program progress and create programmatic plans and strategies that are more specific and not generic. Our belief that vulnerable children come from vulnerable families needs an approach that allows for targeted actions at an individual family level, which was only possible using mobile-based applications that threw up trends that were easy to view and understand by the women themselves. So for example, in a matter of weeks, by collecting family data using the mobile application, our women's groups were able to disaggregate data to identify about 1,000 children who were out of school and almost 1,300 children who were at risk of not returning to school once the schools reopened. They are now strategizing ways to work closely with these children and their families to ensure that the children continue education and remain safe. Monitoring has been made far more easier. The dashboards and the back-end analytics help our teams to have access to all the relevant information on a real-time basis on their laptops wherever they are. It helps us to monitor the activities on the field and also monitor the kind of actions being taken to reduce risk for families and children. When we initially decided to move from pen and paper to tech-driven innovative solutions, we were unsure how the community would accept it. But our communities demonstrated that they were more than ready to accept, adopt, and embrace technology. Madhu Kumari, one of our community women volunteers from Patna, shared that she feels proud to see her name on the mobile application and realizes that it comes with a sense of responsibility. She shared that the app has made their work much easier and far quicker, and that it's exciting to look at the data collated in one space at any given time, rather than flipping through the pages of their long registers. Whilst using technology as a means of collecting data and actioning localized data is an integral part of our program and what we do, the use of technology became even more relevant and urgent during the national lockdown and the COVID crisis. Access to technology and access to basic means of communication through phones allowed us to break isolation with some of our most remote and vulnerable groups. The process of recovery and rebuilding in the aftermath of the lockdown is going to be a long and tedious one. But we believe and we know that by remaining connected through technology is one of the ways for our communities to move forward. For us at Aangan, we believe that accountability for preventing and responding to child harm lies with the community and the state equally. We are just leveraging the power of technology and data to ensure that this happens so as to ensure that every child gets the childhood that he or she has the right to. Thank you.